how are you today? My name is Dr. Wright. It's nice to meet you. Yeah, we've met before, haven't we? I thought so. You were in here with some headaches last time, but I thought we had gotten that sorted out. What's going on now? Okay, so you've got frequent migraines. You're having trouble sleeping. Okay. Let me ask you a couple questions first. Not very many. First of all, can you tell me your full name? Okay. What is your full date of birth? Okay. Now, what year is it and what is the president? Yeah, okay. So, how often are you having these headaches? Okay. Um, when you have the headaches, is there a specific spot that it starts? Or can you point to a specific spot where it hurts the worst on your headache? Okay, so it's on the left side of your head. Okay. What I'm going to do is I'm going to run some tests. I wouldn't really call them tests. We already did blood work before you came here. That seemed to have checked out just fine. So you don't have any infection. Every vitamin levels are okay. Sometimes if your potassium is low, then it can cause muscle spasms. And if you have muscle spasms, then you can have a tension headache. So I like to check for those just in case. Most at 60% of the time, that usually tends to rule out everything. But I'm going to, if you don't mind, I'm going to touch around on your face and on your head and kind of see if it hurts. And I want you to tell me if the pain gets worse, okay? Okay. So I'm going to warm up my hands real quick. They're kind of cold. Yeah, and we're out of gloves. I'm sorry. No, our suppliers, I guess there's a shortage with our supplier. This happened during COVID and we had to reuse gloves, but I think that I'll be okay if I sanitize before and after. You ready? Okay. So first I'm going to start on your temples right here. I'm going to just kind of tap and touch on that for a second. How does that feel? Okay, all right. So if you went blurry. Did your headache get worse? Okay, on the left or right side? On the left side? Okay, so before we do anything, I'm going to touch the left side here. How's that feel? That's okay. Okay, good, 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 good. Now I'm going to touch the left side. I think I said right side a second ago. I usually try to flip it for anatomical reasons. But... Okay, so this does feel a little tender. I'm actually going to touch over here, up on the top of your temporal bone on this side. How's that feel? Okay, so it feels okay? All right. You probably already know what I'm checking for. I'm going to check the temple on the other side. Yeah, okay. Now, I'm going to do something strange. I want you to clench down on your jaw. When you clench down on your jaw, I'm going to feel the thickest point of the muscle, and then I'm going to have you keep clenching, not as hard as possible, just enough to keep that muscle flexed. I'm going to press on both sides, and I want you to tell me if you feel any pain. Got it? Okay, go ahead and clench. Okay. Okay, ready? No pain? Okay, that's good. Sometimes if you grind your teeth or you clench your teeth during the day or during the night, you can also get headaches because all of those nerves in your face are connected and they can initiate headaches. Yeah, it's quite common, to be honest. So now I'm actually going to go down underneath your chin here, right over here. You ready? Okay, nothing seems to be swollen. Let me check on your right side, right here. I'm going to press on the side of your neck a little bit. Nothing? Okay. I'm going to press on this side a little bit. Nothing? Okay, okay. I'm going to move down to your shoulders a little bit. I'm going to press on your side. No? Press on this side? No? Okay, that's good. So I think I can go ahead and rule out that it's a tension headache. I don't think it's a tension headache because it's, like you said, it seems to be isolated a little bit on your left side here. And when I touch on that side, if it was a tension headache, most of the time tension headaches will run from shoulder all the way up into your occipital bone and around your temporal bone to your temple. Sometimes they'll even hit your frontal bone and they'll go all the way down to your eye muscles, and it's kind of painful. But that doesn't seem to be going on here. So I'm going to do a couple of other tests, and then just something simple I want you to tell me. First thing I'm going to do is I want you to tell me when my finger gets out of focus. Okay, I'm going to start back here and I'm going to move up forward. Okay. Okay, so I'm going to start back here. I'm going to wiggle my finger just so that you can see it a little bit more. So we're going to keep moving forward here. Out of focus. Okay, that's fine. So I'm going to do down here. I'm going to start down here and I'm going to wiggle forward for you. Now I want you to tell me when that movement gets blurry. Okay, it's starting to get blurry. Okay. Now I'm going to do it up here. And I want you to tell me when the movement gets blurry. Honestly, this is a little more typical with an eye exam. Blurry, okay? Now we're going to start down here. Move it down here. Blurry, okay. Now what I want you to do, I'm going to start in the middle. I want you to tell me when it gets out of your field of vision, okay? So I'm going to go up, down, and then I'm going to go right, left. Okay, so are you ready? On the point, I want you to look at the point of this. Okay? When I move my finger, I want you to keep looking at the tip of my nose and tell me when my finger is out of your peripheral. Can you do that? Okay. I'm just making sure that you're okay and comfortable with doing it. No worries. All right, so I'm going to start here. Now remember, when my finger moves, look at the tip of my nose. Tell me when you can't see my finger anymore. So I'm going to go up. Okay. Good, good. I'm going to go down. Okay, good, 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 good. Now I'm going to go to the right. Okay, that's pretty far. Now I'm going to go to the left. You can't see that? Okay, I'm going to do it one more time. I'm going to go to the left. Okay. I might know what's going on, but I want to do a couple more things with you before we discuss that, okay? No need to worry. There's nothing wrong, okay? Okay. Now, I am going to hold my hands up. First, I'm going to have you look at my left or my right hand, and then I'm going to throw some numbers up, and I want you to tell me what they are. Are you ready? So stare at this hand right here. Stare at this hand. Yes. 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 Okay. Now we're going to do the exact same thing to the other side, okay? Yes. 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 No. I wanted to try to get you with that one. I have 4 fingers on each hand. So sometimes I like to throw my whole hand up and people instinctively say 5. And then I just tell them they're wrong and they get kind of confused. It's okay. It was just a joke. I do it all the time. It's how I get my kicks around the office. Yeah. I have to do something to laugh. We keep the lights down because most people have a headache when they come in. Yeah. Okay. Now, I'm going to do similar testing like that, but I'm actually going to do it with one eye closed. I'm actually going to start with your left eye closed, or at least covered up, okay? Okay. So, what I'm going to do, I'm over here. What I'm going to do is the same thing. I want you to tell me when this finger gets out of focus. Okay, good. Good. I'm going to go up here now. Okay. Now I'm going to go down here now. Okay, good. Now, what I'm going to do, I'm going to cover your eye again. And then this time, I want you to tell me, I want you to look at my nose with that eye specifically. And I want you to tell me when you cannot see this anymore. Okay, that's good. Go up. That's good. And I'm going to go down. That's good. Perfect. Now, I'm going to do this one more time. I'm going to cover you again. Don't worry. This is the last one for this eye specifically. How many fingers? How many? Good. 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 I didn't get you that time. I didn't get you with that. Yeah. Okay. So are you ready to do the tests on this eye here? Yes. All right. So I'm going to cover this eye right here. It's okay. No worries. So the first thing I'm going to do, I'm going to start in the middle. I want you to tell me when you're blurry. Okay. You're blurry there. Okay. I'm going to start in the bottom this time. I want you to go tell me. Okay. Ooh. You okay? Your headache got worse? Okay. Blurry. We got blurry. Okay. I'm going to keep going. Are you okay now? I'm going to keep going just to make sure. Just to finish the test, okay? So start up here. Okay. Good job. Now, we're going to start. Tell me when you can't see it. Okay. Right there. You sure? Okay. I go down. Okay. I go up. Okay. How many? Okay. How many? How many? You got blurry again? Okay. So I think I might know what the cause is, or at least the area that's causing the problem. It's kind of obvious if you couldn't really tell. So I think what's going on now is it's definitely that left eye. Um, you'd be surprised. You'd be surprised how much your eyeballs can cause migraines. Your field of vision is off in one eye and not the other one. Then your muscles around your eyeball, they can tense up and you don't even realize it. And then halfway through the day or a couple hours into your muscles being really tense in that eye, you'll trigger a migraine because those muscles are so tense they can't relax. And honestly, it could be, I wouldn't stress out, it could be something as simple as getting an updated prescription. Maybe you are getting, maybe it could be caused by stress. Stress could be tensing up those muscles. However, I do want to refer you to an ophthalmologist so that way he can just kind of take a look. If it is an updated prescription, he'll be able to do that. But if it's something else going on with that eye, then he'll be able to check it out and see what's going on. He'll get you fixed up, okay? Yes. Do you have any do you have any questions? Okay. Um, until you can get into the doctor's office, which I'm going to have my front desk lady give you a referral. And if it's a really long time or a really long wait, give me a call. I can either get you a referral to someone else, or I can just have my front desk lady call and see if she can try to get you in sooner. That doesn't always work out, but sometimes it has happened. Okay. All right. I'm going to give you a prescription for a muscle relaxer, a very mild muscle relaxer. That way, if that's what's triggering the migraines, the tension around your eyeball, then it will help. It'll help relax that and at least help you sleep. Something that you can do during the day instead of taking a muscle relaxer, because it'll make you sleepy, is put a hot compress over your eyeball and lay down for a couple of minutes. That will help increase blood flow to the area, loosen up those blood vessels, and it'll help those muscles relax some too, okay? Okay, good. Do you have any more questions, or is there anything else that I can do for you before we leave here? Okay. Well, you look a little miserable, so why don't you go get that prescription refilled and get some rest? If you need anything else, give us a call, okay? Okay, and again, it was nice to see you again, but I hope you don't have to come back. Thank you. All right. Bye. Have a good one.